Hey everyone, last week we described in depth what CBT is. This week I'm going to go over the more practical how aspects of cognitive behavioral therapy. Specifically, I'll be explaining a lot of the techniques. Now, as a disclaimer, I want to emphasize that even after watching all of my CBT videos, you won't necessarily have the tools to practice this therapy on others. Doing this stuff under the supervision of a trained professional is still needed. Only after having so many supervised hours will you be able to accurately practice CBT and call yourself a CBT practitioner. Questions are the main focus of many therapies, but CBT therapy especially. The kinds of questions used in CBT are known as Socratic Questions, named so after Socrates. These kinds of questions usually consist of a back and forth between the therapist and client. The basis of these questions is looking at how truthful thoughts and beliefs are, or what assumptions these thoughts or beliefs come from. One of the benefits of Socratic questioning is that a worksheet of questions can be given to the client for their use outside of therapy. Such a worksheet would ask the evidence for or against their belief, if there are alternative and more reasonable explanations, what the worst that could happen if their belief was true, and how they could cope if it did happen, and what's the best that could happen, as well as what's the most realistic outcome. These questions can be divided into evidence questions, alternative explanation questions, decatastrophizing questions, impact questions, distancing questions, and problem-solving questions. The above questions contain examples of evidence, alternative, and decatastrophizing questions. Impact questions ask things like, what is the effect of me believing that? Or what is the consequence of me changing my thinking? Distancing questions try to give you a different perspective other than your own. For example, these questions might ask things like, what would I tell a specific friend or family member if they were in this situation? Lastly, problem-solving questions ask, what should I do? The answer can involve behavioral or cognitive components. Perhaps action, like talking, might be the best answer for somebody. Or a cognitive process, like thought stopping, might be a better alternative for somebody else. A related technique is called the downward arrow. Sometimes it's referred to as the 3 whys. However, why questions can be perceived negatively, so stick with what questions. The downward arrow technique is used to uncover core beliefs, and it goes like this. A client will expose an automatic thought, and the therapist will ask, what does it say about you, or what does that mean about you? It can take multiple times, or it can be after the first time of asking that you discover a core belief. But once you do, that's when you stop and do the next technique. When you discover a core belief, you need to see how much the client believes it. So just ask the person, on a scale of 1 to 10, how much do you believe that belief? I usually tend to use 1 to 100 just because it seems to get people to think about it a little bit more deeply. Another related technique is known as the mood check. I believe that even non-CBT practitioners should utilize this. It's a very easy and simple way to check progress. On a scale of 1 to 10, how do you feel right now is all it requires. Tons of follow-up questions to this answer can be really beneficial. For a low number, ask what has the client feeling this way. This can help streamline the client into getting into their emotions. For high numbers, ask what's the difference about today that's got you feeling so good. This can lead to solutions that may not have normally presented themselves. The next technique is called thought challenging. Now, you normally don't have the client challenge automatic thoughts. Also, if the client doesn't believe the core belief that much, or it's more peripheral than central, it's not worth challenging either. The actual process of challenging thoughts uses several techniques. You can use Socratic questioning, pro-cons list, you can look at the evidence for the beliefs, or you can use distancing questioning. Another method for thought challenging is called the cognitive continuum. Basically, you have 2 extreme examples on a spectrum. For example, on one end you might have success, and on the other you might have no success. You ask the client where they would fit on the spectrum, and then after you have them look at the graph and place others related to each end. The no success side may have the person who does nothing, and someone who tries but doesn't get their outcome. On the success end, you have those who put in huge amounts of work and gets the outcome they want. After looking at all of these labels, you can question whether the client still fits at where they originally placed themselves. Behavior experiments are a way of thought challenging. As an example, someone who suffers from social anxiety may not try to ask people to hang out of fear of rejection. As an experiment, the therapist may ask the client if they would mind asking their friends to hang out. some extreme cases have asked people to ask out as many strangers as they can. However, it is important for the client that you maximize the chance of a positive outcome. The example in the book that I'm reading from asks the clients questions like, who would be the easiest for you to ask? And what might be some alternative reasons that they say no, other than that they don't want to hang out? This is both to maximize positive outcome and to counter the blunt of a negative outcome. The motive behind behavior experiments is to give the client a more realistic belief. Ideally, in our example, after asking people to hang out, the client's belief will go from nobody likes me to some people like me. Emotional intellectual role plays usually have the client as their emotional side and the therapist as the intellectual side that challenges maladaptive thoughts. Then they reverse roles, the client challenging the emotional thoughts that the therapist plays. This gives the client a model and some practice doing the challenging themselves. Acting as if is a technique for someone who can't believe a new belief. Remember how I explained that in this model, thoughts influence behaviors and behaviors influence thoughts? Well, that's exactly what this technique is about. Keep in mind that an unhelpful belief needs to be modified at least a little bit before this technique can be effective. The therapist usually brings it up like this. If you believed X, how would you act? What would you do? And then the therapist asks the client if they would attempt these new behaviors. Sometimes thoughts take the form of images instead of words. Following an image to completion might help this. Usually we think of the worst point, but asking what happens next usually helps tease out the reality of the image. For an example, check out my Advanced Anxiety and Stress Techniques video. Lastly, you have worksheets, homework, and coping cards. These are used alongside therapy to help provide a more complete and lasting result. Outside of the weekly therapy sessions, clients may be asked to do some kind of homework, such as a behavior experiment, a journal, or filling out some worksheets to challenge thoughts. And then they have coping cards, which are good for clients if they start getting deep into their negative cognitions. However, all of these prevent relapse after therapy has been completed. These are only a few CBT techniques, but the most useful ones in my opinion. For more in-depth description as well as examples on how they are used, check out the second edition of Beck's Cognitive Behavioral Therapy. I hope this video was helpful. Thanks for watching, do me a favor and have a good day.